Hi, hello. So this is our on and off area where we can get into our PPE and out, and then we are still having to kind of reuse some of our gowns. So this was what we come up with to try to keep them in an area that's still not spreading germs everywhere. And then our shields, gloves, extra supplies are all below, so we can get ready before we come into this part.
Cool.
And then for our patients who have very mild symptoms, they just know they've been exposed, they're needing a test of some kind, we keep them outside under our carport area so it's covered from the rain, and we have our exit door where we can go out very easily to them, and even our door is covered outside so we're staying dry. So we can go out, assess them in the car, kind of swab quickly and come back in. And we figured that's too kind of how we can keep our patients moving pretty quickly, because sometimes we get 5 to 6 several kind of lined up all together, so we can get them in and out quickly that way. For our patients who are pretty symptomatic, need a better exam than what we can do in their car, then we're bringing them inside. So we'll have them pull around and park on the opposite side of the carport and come in the door here. So we've got 2 stations, a nurse and practitioner together, typically are down here most of the day now. So then this is kind of our small waiting room, but so far we have been lucky enough to just have one patient in and out at a time.
Good.
And not have a waiting room area. So then we've got 3 bays if needed for our patients that are coming in. We only have 1 with the bed, so if they're really sick and need to lay down, our first one is with the bed here, and then 2 more bays down the hallway. We're expecting, as flu season comes, we will need more room, so we try to kind of prepare ahead of time and have those as needed. And then this is our smaller area. Just we've got, of course, our COVID supplies, flu strep. We can do blood work down here if we need to. Even restroom was at the end for UAs, and pretty much all of our testing that we can do upstairs, we can also do down here.
Okay.
And then kind of like we talked about before, our x-ray is just right at the top of the hall. So if we need to go up for x-ray, we can, and clean a very minimal space, because we're still definitely wiping everything, spraying everything between every patient that comes in and out.
So who gets to go upstairs?
For x-ray,
Well, just come in the front door, for example.
so all of our patients are screened before they come in the office. So only our patients upstairs are those with no respiratory symptoms whatsoever.
Okay.
If they have any kind of cough, congestion, sneeze, anything,
They're all
pretty
coming
much,
down
we're
here.
having them come down here.
Okay. It's worked well?
Very well.
Now, you didn't set this up originally, right?
Nope. So originally we were seeing everybody just parking their cars outside. It was burning hot. We got soaking wet. And then we went to a small tent right outside the door. And after that blew away twice, we gave that up. And then got the carport. And then we realized, but some patients are really sick. They need x-rays. They need labs. We can't do that in the car. And so then we made up our plastic rooms.
Got it. Perfect. And if they can't go up and down stairs?
Then we have them come around to the front of the office, and we have our exit doors on that x-ray side. They actually come in that exit door as they're closer, less room to clean, less exposure for other people, and then go right back out.
Great. Awesome. Thank you so much.
You're welcome.